The National HIV and AIDS Strategic Plan 2022 to 2026 provides stakeholders across the nation with a roadmap to accelerate efforts to end the HIV epidemic in the country by 2030. Hello and welcome to this episode of The Last Mile with NACA. I am Adesuwa Osui. The National Agency for the Control of AIDS, NACA, has organized a series of engagement with key stakeholders across the country, all in a bid to develop a national HIV and AIDS strategy document tailored to Nigeria's peculiarities. This bit brings you highlight of a 3-day Northern Consultation held in Abuja. Don't go away.
In a bid to align with new global strategy on AIDS by the United Nations, stakeholders in Nigeria, led by the National Agency for the Control of AIDS, NACA, at several fora, meet to review and compare with the national strategy to either adapt or adopt aspects of the global strategy to suit our peculiar context. This process of review led to a recently concluded 3-day Northern Consultation on the National HIV and AIDS Strategic Plan 2022 to 2026 Political Declaration and Global AIDS Strategy. The event had in attendance representatives of state AIDS control agencies, NACA, civil society, community and faith organizations, health professionals, and other relevant stakeholders. The Deputy Director, Policy, Planning and Coordination, NACA, Dr. Effiong Eno, gave an overview on the National HIV and AIDS Strategic Plan NSP 2022 to 2026.
The National Strategic Framework was completed in 2020, going into 2021. Logically, we should have started the NSP by 2021. But two great events happened. By the beginning of Q2 of 2021, there was the release of the Global AIDS Strategy. By June, there was yet another global event that culminated in the Global Political Declaration on HIV and AIDS at the UN again. So those two completely changes the focus, the details of HIV response globally. Nigeria cannot afford to be left behind. And so we had to come back home and domesticate those documents to assess and determine the gaps between our document, National Strategic Framework, and the Global AIDS Strategy, and outline the things that must go into the National Strategic Plan for HIV and AIDS. And so the National Strategic Plan couldn't but be done now to accommodate the Global AIDS Strategy, the Political Declaration on HIV, and in the course of the inclusive consultations, we also had to take on board the WHO Global Health Strategy, which speaks to what we are doing.
Professor Morenike Ukbong, a consultant in the development of the NSP, explains that the process for the plan has been the most elaborate.
This has been an extensive process. I've been involved with the development of the national strategic plans and national strategic frameworks since the very first one. I think for me this is the most elaborate in terms of the engagement process. It started centrally, it then went into the states, regional engagement, and then it's coming back again for a collective review. And I've seen, I tell you, it's amazing the depth of knowledge of people. I have seen this process for years. This is one where people bring in expertise, knowledge, and there is evidence enough to drive the process. In the past, we didn't have this level of evidence, program level evidence, research level evidence. There's still gaps, but it is far, far, far from where we are. So I think one of the things we'll be seeing with this process, which is in ending now, we still have one more step, is a strategic plan that really addresses our needs because it's evidence-driven, and less so adaptive, which has been happening prior to now. But now it's our data that is making us see what we would need to address, and that should result in a lot more mileage than we've done before.
The document being developed is key to the National Alignment 2.0, which aimed at sustainability of the HIV response beyond donor funding.
So the National Alignment is a joint effort of the Government of Nigeria, PEPFAR, and Global Fund. We had the first version that started around the year 2020, and that is why we were so successful. We were able to register a lot of patients during COVID, and that's why the whole world is talking about Nigeria. So we're now saying 2.0, where are we going from there? National alignment is about sustainability of everything. We know that partners are not always here. Partners come, partners go. The range of what they will do also varies from time to time. But with that national alignment, we're saying we want to reposition Nigeria in such a way that whether the partners are there or not, Nigeria can continue to take giant strides in the field of HIV and AIDS. Nigeria will achieve 95, 95, 95 by the year 2025 or even before then. Nigeria will end AIDS by 2030. That's the whole idea. So we must talk about it in this document, because this document is going to guide all we're doing for the next 5 years. That's why.
Human rights and HIV are intimately linked in that human rights abuses are one of the drivers of the HIV epidemic and increase its impact, hence the presence of the National Human Rights Commission at the workshop.
While the mandate of NACA covers HIV/AIDS itself, the entry point for the National Human Rights Commission is in the area of stigmatization and discrimination. It is within our mandate, so that people living with HIV are not supposed to be discriminated against. And if that happens, it means the National Human Rights Commission is there, to be referred to handle that area. From our record, from our data in the office, we discover that those stigmatization and discrimination is very rampant, but yet we do not have that number. We don't have a lot of people coming to the commission to complain about these violations. When you compare it to that of maybe torture, gender-based violence. So I think this document is apt. Then you have to let people know that the National Human Rights Commission is there. Whenever your rights are being violated, you can go there to report.
Some participants shared their thoughts.
The beauty of this particular workshop or this particular NSP is that we are bringing back the importance of prevention in HIV. Over the years, it has been treatment, and we fail to understand that in HIV prevention, it has 3 legs. 3 legs drives HIV prevention or HIV response. These are behavioral interventions, these are biomedical interventions, and these are structural interventions. And for you to actually say that you have been able to provide someone with comprehensive HIV preventions, these 3 legs must come to play. But today we're talking about putting on the inequality lens. Inequality lens is about making sure that behavioral issues are tackled, making sure that structural issues are tackled, so that they can be able now to assess even the biomedical interventions. So I think this is the beauty of this workshop, of this NSP, and we're so glad that issues surrounding prevention is now bring to the front burner. That to remind us again that we need to ensure that those prevention interventions, as regards behavioral interventions, as regards structural interventions, are critical.
A similar thing had happened in the southern part of the country where stakeholders on that end were there. Now we are doing for the northern part of Nigeria where heads of State Agency for Control of AIDS, developmental partners, organizations who are the stakeholders, the critical stakeholders, decision makers, the specialists in the HIV space in the northern part of the country are here, where all of us are seated together to critically analyze that document, look at areas where we need to add flesh to, and put things into perspective in view of the new political declaration and the global AIDS strategy. This document will be fully owned by us because we are also putting in our local context, our local circumstances at the subnational level into this document, and the implementation by the special grace of God will also be at the local level. And this will now become like our Bible, a document that we'll all be implementing at the subnational level and also at the national level to ensure that we get rid and fight HIV/AIDS to finish by the year 2030.
In Nigeria, generally, you cannot talk about HIV without talking about the youth, because we are the most infected and the most affected groups among all the age bracket. Having said that, the process of this, I think NACA, they've got to the place whereby they recognize the importance of the youth in this process. So in all the stages, this is not the first stage. So NACA have been able to ensure that the voice of the youth, is well captured. If you look at every other groups in this house now, you see that the youth were given more priorities by giving more youth access to participate in this process. So we are not just sitting as, as a receiver. We are also part of this process. NACA go to the extra line because before this process started to build our capacity about this whole process. And based on that, you can see we have in each of the groups, you can see the youth in each of the group so that they can be able to do what? Make impact, make contributions in the whole discussions. So I believe that the final the document will actually reflect the voice of the youth, which is what we've always agitated for.
Everything that's happened in this forum, when the document finally comes out and the police key into it, as we are going to key into it properly and follow all the strategic plans that have been stated there, I'm sure by the end of 2030 we'll be able to kick HIV out completely, not just from the police, but from the general public, because this plan is well thought. And not just the police, other uniform agencies have been properly captured this time around. Before now, we're placed under the vulnerable group, and that kind of excludes us for some of the programs that NACA has been doing because they have been working on key populations. But with this document and uniform men, the police properly represented, I'm sure we'll get good results.
The issue of health is a concern for everybody. As you know that every one of us as human beings have right to health care and medication. So the program has been of tremendous eye-opening to us as Christians, and hope that when I get back, I'll be able to tell others the importance of the issue that is at stake. Nobody is immune to HIV, except you take all the precautions that are necessary. So that is why we need that education. Even while claiming faith, that with faith this can be, that can be, you also have to take the human precautions that are necessary to avoid some of these things, the HIV, the TB, and of course every other communicable disease.
The event was very inclusive and interactive as directors of NACA and consultants on the NSP 2022 to 2026 fielded questions from representatives of various organizations.
Unequal access to HIV prevention and treatment services perpetuate HIV among vulnerable population groups. This year's World AIDS Day seeks to equalize access across populations that are marginalized among vulnerable and key affected population groups by removing economic, social, cultural, and legal barriers to HIV prevention services across population groups that are vulnerable to HIV. Globally, we call for equalize. Locally, we say equalize to end AIDS.
Welcome back. From Abuja, we move to Lafia, Nasarawa State, for an anti-discrimination awareness workshop to educate policymakers and community leaders and members on the Anti-Discrimination Act, related rights, and how to seek redress. Keep watching.
Stigma and discrimination are a barrier to effective HIV prevention and treatment programs. As part of the federal government's efforts to curb the spread of the disease through legislation, the Anti-Discrimination Act was signed into law. In a bid to create awareness on the anti-discrimination law, the Network of People with HIV and AIDS in Nigeria, NEP1, with support from the National Agency for the Control of AIDS, NACA, organized a 2-day sensitization workshop in Lafia, Nasarawa State, to engage heads and leaders of relevant stakeholders on stigma and discrimination within the state and create awareness on the Anti-Discrimination Act.
NACA has been supporting the state over time to domesticate the law. Fortunately, the states had a law even before the national law. Anti-stigma law for Nasarawa State was actually passed in 2012, while the national was actually passed in 2014. But the work of NACA here is to support the state to make sure that they create more awareness around the anti-stigma and discrimination law.
The purpose of the workshop is to create awareness on the Anti-Discrimination Act and also to ensure to look at what the state has done or they're doing, and also see where there are challenges and gaps, and see where NACA can come in that component, in the human rights component of our national response. Working with several other MDAs, we are collaborating with NEP1, who is a major stakeholder and one of our partners in the national HIV national response.
The importance of this workshop cannot be overemphasized, because looking at the rate of which stigma and discrimination is falling, the rate of which people living with HIV are accessing services in their various health centers. So this poses a lot of danger as a result of stigma and discrimination, where our people are receiving in terms of health services, which thereby lead to a lot of challenges. A lot of them defaulting in the drugs and then many other things. So government have played their key role in terms of enacting series of laws and then anti-stigma bill in order to protect the right of people living with HIV and AIDS. Yet, there are still cases of violations of this right and privileges. So that is where this occasion is organized in order to sensitize the public and then various stakeholders so that they enforce the law that they have enacted.
NACA and relevant stakeholders such as the National Human Rights Commission continue to embark on advocacy visits to state governments to adopt the Act.
What we've been doing over the years is sensitization, and we've been assisting in providing technical legal support and also technical support in the other aspects. One of the departments, CPCS, had been working closely with stakeholders in this field, ensuring that there is domestication or adoption of the Anti-Discrimination Act at the state level. And we've seen tremendous support. We've seen lots of states taking this up, and it's of great achievements to NACA. And recent, a number of states, they are draft stage, they have sent it to us to look at, to see if it aligns with the intention of the Federal Act, and also to see whether they are in the right direction. This is an ongoing process. NACA continues to support the state. We have our centers, our zonal offices, that they serve as a pivot between the headquarters and the state levels to get to the community.
It's all about advocacy and letting the government know and other states know what they need to do to be able to further protect and promote the rights of Nigerian citizens, because there are a lot of violations that happen with the issue of status of HIV. So the National Human Rights Commission is championing the cause to help make states understand that they need to domesticate these laws so as to be able to promote and protect the rights of people living with HIV and AIDS. As it is now, it's all about advocacy, recommendations, and advice to the states so that they can all domesticate these laws in their various states and make them local.
The Anti-Discrimination Act of 2014, if adopted and properly implemented by all states of the Federation, is a veritable tool to help Nigeria achieve the global target of ending HIV by 2030.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a #1 enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
We can end AIDS if we end the economic, legal, and social inequality that continue to fuel HIV and AIDS. For Nigeria and for me, it means 4 things. 1, increase access to HIV testing and treatment, but also for preventive services for those left behind. 2nd, reform the laws, the policies, and then the practices that unfortunately continue to fuel stigma and discrimination against people living with HIV and AIDS and key population. The Anti-Discrimination Act 2014 should be assented and implemented in all states. Thirdly, it means increased domestic resources, and Nigeria can, so that Nigeria can reduce its dependency on external sources to fund its response. And then fourthly, putting the community of people living with HIV and AIDS at the center in such a way that they can play a key role in the implementation and the delivery of services. For Nigeria to be safe and healthy, let's equalize.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching. And as we draw closer to the 2022 World AIDS Day celebration on December 1st, let us equalize to end AIDS. Do not stigmatize or discriminate people living with HIV. And lastly, know your status and take action. Till next week, On the Last Mile with NACA. I am Adesuwa Osuyi. Goodbye.